As our Chief Operating Officer for Emergency Response Services, Dr. Rob Grierson. I have a brief statement that I would like to make, and then the three of us will welcome your questions at the end. Yesterday, Manitoba experienced one of the worst tragedies this province has ever seen. There are no words to express the tragic nature of this incident or to properly acknowledge the impact that this type of event has had on families, first responders, healthcare teams, and entire communities. Our thoughts are with and will remain with all those involved, those who are lost and now who are being grieved by loved ones, those who are fighting for their lives with loved ones at their side, and with the multitude of individuals, teams, and agencies that played an enormous and vital part of this response. We can now confirm that there have been no new deaths recorded since we last updated the media yesterday afternoon. 10 patients remain in hospital and are being cared for by teams in Brandon as well as Winnipeg. And Dr. Young will be able to answer your questions on patient status as much as possible. We continue to work closely with RCMP to ensure families are provided with as much information as possible. We understand that the RCMP will be providing an update later this afternoon. Emergency situations are what we train and prepare for, and when they arise, a response is mobilized that involves every aspect of our health system. Yesterday's response involved teams from across Manitoba and into Saskatchewan. 13 ambulances and additional support crews from Health, ERS West and South Zones, as well as Brandon Fire Paramedic Services and Carberry Fire Department responded to the scene, assessing, triaging, and transporting patients to receiving hospitals. Approximately 30 paramedics responded to the scene, in addition to police and fire response. Brandon Regional Health Center received the majority of the initial transfers, and we thank them and their care teams for their incredible response. 2 patients were transferred from the scene directly to Health Sciences Center. An additional 7 transports happened over the course of the afternoon and evening from hospital and Portage La Prairie, involving 4 planes and 2 helicopters, as well as ground transportation staffed by various crews from Shared Health, Emergency Response Services, STARS, and Lifeguard Sask Air. These patient transports were coordinated by a variety of teams, including Vectors and Medical Transport Coordination Center from within Shared Health, as well as teams at each of the hospitals involved, including Brandon, Portage, and Winnipeg, as well as STARS. Prairie Mountain Health quickly established family supports in Brandon and Dauphin, and HSC did the same in Winnipeg, staffed by social work, spiritual care, crisis response center, and patient relations staff who worked tirelessly throughout the night. Health regions throughout the rest of the province also played significant roles in this system-wide response. 28 patients were transferred from HSC throughout the day who were moved to continuing care facilities in the Winnipeg Regional Health Authority, Interlake Eastern, Southern Health, Santé Sud, and Northern Regional Health Authority. These moves by patient transport teams and care teams they created significant capacity at HSC so that they were able to receive the patients. And while it is not possible to plan for every possible occurrence, the existence of strong and effective emergency and contingency plans And the partnerships that we have in this health system make it all work and make it an invaluable process. The relationships that exist between the health regions, the healthcare facilities, and many other agencies and stakeholders allow for a response of this nature to occur. Manitoba's healthcare system is sophisticated and complex with many different moving parts. But when an emergency occurs, it is those relationships, the skills, and the capacity that make the providers, the teams, and the system capable of this incredible response. We know that yesterday was an awful and difficult day for all those involved and will have a lasting effect on many. And as we begin to fully process the devastating effect, I encourage everyone to seek out mental health supports if you need to. Many resources are available to the public and are listed on the Shared Health website, and staff are able to access resources through their managers and their workplace. Thank you very much, and we will now take questions.
Can you give us an update on the conditions of patients that are in the ICU right now and where we're sitting, just how critical this is right now?
Yeah, we have a total of 6 patients in critical care at the Health Sciences Center with severe injuries. A number have received operations and more operations are planned, but these injuries are quite significant.
When we talk about significant, are we talking life-altering or potentially that we're keeping an eye on the potential for more fatalities possibly?
It's possible, yeah.
For the patients that are in hospital now, have all of their families been notified?
To the best of my knowledge, yes, but I think there's still some unknowns with some family members.
Can you take us through that process? I mean, what we heard yesterday, it was possible that this was going to be quite a while to actually notify next of kin, just given the state of the severity of the bus crash.
Correct, it is going to be quite some time. RCMP are still working through that process.
Have all the deceased been identified?
Those confirmations haven't been received, no.
I know it was touched on yesterday, but can you talk about types of injuries that the people in hospital are doing?
These are quite extensive injuries. Like I said, 6 of them are in critical care, receiving life-saving support. Many orthopedic injuries, as you can imagine, and some others as well, but predominance of orthopedic injuries.
Lanette, yesterday we spoke a little bit about the Code Orange and what goes into that, and now we know a little bit more about moving patients and trying to make space. Can you talk about just the efforts that need to go into something when we don't know at the beginning what we're dealing with, and then trying to make room to make sure you can care for those that are critical at this hospital?
Yeah, I can start with that, but I think Dr. Grierson will also have some really good insights to share with you on that initial response. But when a Code Orange is called, and it was called in Brandon and Prairie Mountain Health, as well as at Health Sciences Center, the team has protocols in place, and they know exactly what to do. And the reports that I received from Dr. Young at the site level is that people were calm, they were prepared, they were all working together, and it is a whole hospital approach, but it's also that provincial system approach. So people reach out and they offer to help, and they work. Everybody's working at the same time in harmony to make sure that we have the capacity for the most acute patients. So they did transfer, I think 11 went to the Winnipeg Regional Health Authority, and then, as I said, they went to other sites or community-based environments. But it was a tremendous effort, and it's really something to see our health system, the people working together for the good of patients. Did you want to add anything more, Rob?
Sorry.
Thanks. Just before I answer the question, I'd just like to make a couple quick comments. So on behalf of myself and Shared Health ERS, I'd like to extend sincere condolences to everyone involved in the incident, the families, the entire city of Dauphin and the surrounding areas. And obviously our thoughts are with those people still in hospital. I'd also like to acknowledge the amazing work, first responders, police, fire, paramedics, air ambulance teams from Manitoba and Saskatchewan, hospital staff in Brandon and Portage, and obviously our staff here. You can never fully prepare for such tragedy, but everybody rose to the occasion yesterday in short order and provided the highest level of care. And so coming back to the question, I mean, obviously, once you have confirmation of an incident like that, then everything goes into basically action mode. The hospitals need to move patients that can be moved safely, whether they move them to other beds within the hospital or we activate resources to try to move them to other facilities. So I can say that that happened in Brandon. I don't believe it happened in Portage, but it certainly happened at the Health Sciences Centre to make room for the capacity, because obviously the initial reports, you have a rough idea of the number of individuals, but you don't really have a sense of the casualties. So in these kinds of instances, you prepare for the worst, so to speak. And likewise, from the emergency response service, I mean, we mobilized as many resources as we could to the scene, recognizing that we also have to maintain a response capacity for other types of emergencies. And likewise, you know, picking up patients that, you know, might have often gone to Brandon, but making sure that they were being provided care in other regional centers like Nipawa and Verdun and Souris. And then we were also able, very fortunately, to mobilize a number of air ambulance resources from Winnipeg and from our neighbors to the west in Saskatchewan. Like, I can't underestimate the importance of that and being able to get all those resources in Brandon in a very timely fashion. And that really facilitated the subsequent movement of patients from Brandon Hospital to the Health Sciences Centre in Winnipeg.
What about the staffing? I'm assuming when something like that gets called, you're going to be calling in resources. Did we have to bring in a number of extra people, or were we calling them in from other communities to help?
I mean, I can't comment on that. I wasn't directly involved in those call-outs. I was more, you know, involved in the coordination. But yes, those requests would have gone out. I am aware that some people who live close to the community that worked for various agencies came in and they supported crews on the scene. So as Lanette had commented, when these things happen, everybody steps up. There's never anybody who says, I'm not coming.
I'm wondering, when we're talking about people between the ages of 60 and their late 80s, if you can just talk about, because of the age and some of those injuries, why they might be even more significant than if we were seeing this in a younger demographic.
Yeah, that's a good point. I mean, age does have a big impact on our ability to withstand injuries like this. So it will impact their recovery. It will impact their outcomes as well. This is an elderly cohort of patients, and so the recoveries will be long and their course could be complicated.
Do you have any sense of when some people might start to be discharged?
And at this point, I don't, no.
Let's say, my mental math's not great, if and how many people have been discharged?
None have been discharged. There are 10 in hospital at this point, 1 in Brandon and nine here.
Can you tell us about the person that's in Brandon, next to our state? Why are they still in Brandon?
I can't comment on that, sorry.
Can you confirm the 15 people who died, were they all at the scene? Or was someone transported and then they ceased from hospital?
I would say that's probably a question for the RCMP afterwards.
I guess we heard from RCMP yesterday talking about looking to Saskatchewan because they've been through something of this magnitude just a couple of years ago. Obviously, we have a team here that's well-versed in their jobs, but is there any reaching out to anybody there in any capacity for our health side? Is there any need to?
No, go ahead.
From a hospital perspective, we've not reached out. This was a lot of trauma at once, but we do receive trauma every day, quite often numbers like this, but usually over a staged period of 24 hours, not so quick. So.
Can you tell us a little bit about there was the room set up for families and just maybe how people are doing. I know we don't want to get too involved in directly speaking for them, but just if that's been impactful to have so far and what we're hearing on that side.
Yes, we did set up an area at the Health Science Center to be able to support families. We had social workers we brought in and spiritual health to be able to support the families and answer the questions as best we could. And that was operational till late into the evening last night. And we shared as much information as we could.
Will that still be an ongoing space for them until people are discharged?
No, we stopped prior to late in the evening last night.
And the status of the drivers,
I'm sorry, I can't comment.
Yesterday, you said there were patients at 4 different hospitals. Can you confirm that number is still 4, or have people moved from 2?
2.
Yeah, there's Brandon and the Health Sciences Center are the 2 sites now.
Any other questions?
Yes, apart from the people who are in critical care, the injured people we're talking about and the deceased people, is there anyone else that was involved in the accident that's been, or that's the total number of people that were in the accident? So we can suppose that the drivers are both gravely injured? Yeah.
I believe we have one last question.
Did you write?
Yeah, I was just coming back to the question about our experience from Humboldt and so forth. I can tell you a couple of comments about that. From that tragedy, from the emergency response side of things and from the STARS response things, we learned a great deal about how to unfortunately respond to these types of emergencies. And I think that was very helpful yesterday to us. From the follow-up with our teams to make sure that they're doing well, we have had a number of national partners reach out on the emergency response service side, and we're setting up those debriefings today. So we are, getting help from other agencies to kind of support those people who've been through that before, unfortunately.
I guess my last question would just be how staff is doing. It's a lot of trauma to take in on their standpoint as well. Doctors, first responders, everybody that's having to deal with such traumatic injuries and families coming in. It's a lot to take in. I was wondering how they're doing.
I mean, I would say it's a little too early to tell at that point. I mean, I know from the emergency response service standpoint, we're checking in with all the staff today, and it's happening as we speak. So, I mean, I think everyone's going to be touched and affected by this. Doesn't matter how long you've been doing the job, you can't prepare for such a thing. So, I mean, I think it's a little too early to tell exactly how everyone's impacted.
Thank you, everyone.
Officials at the Health Sciences Center in Winnipeg giving an update on the horrific collision that happened yesterday on the Trans-Canada Highway. 15 people were killed when a semi-truck and a vehicle carrying seniors collided. A little bit of good news from officials at the hospital today. They say there have been no new deaths. 10 patients remain in hospital, 9 in Winnipeg, 1 in Brandon, and they will continue to brief people as more information comes in. Let's bring in our Cameron McIntosh, who was watching along with us. Cam, one of the things they were talking about, it was the updates on the patients right now. Maybe you could go through that a little bit, because I know a lot of people in that province are just waiting to hear more information.
Yeah, as you say, the good news here is that no one has passed away overnight. And the RCMP were warning yesterday that that was a very real possibility, that the death of 15 people, that number could rise. And so far it has not. So 9 people ultimately brought to Winnipeg, 1 in Brandon. Now this collision occurred about 2/3 of the way from Winnipeg to Brandon along the Trans-Canada Highway. 6 of the people currently in hospital are in critical care. 4 are being treated in a surgical unit. And as you heard the doctors explain there, the injuries are extensive. A lot of head injuries and a lot of orthopedic injuries. So we don't have patient-specific information, of course. And we, at this point, don't know who all the people in the hospital are. We have spoke to some people that have relatives in the hospital that have been involved in this crash. One person that we spoke with outside of the hospital yesterday said that his mother was in the hospital here at the Health Sciences Center and that his father was still unaccounted for. So that's more information we're going to get from RCMP later today as to who the victims are in this and who has actually been identified. But speaking about what's happened here in the medical system, in Manitoba, this is the largest mass casualty event that we have had in decades. And this has put an incredible strain on the healthcare system here, on the emergency response system. You heard them explaining 30 ambulances. Again, this is not near a major center. This isn't happening in a city. This is happening out on the highway, 200 kilometers from Winnipeg, about 75 kilometers from Brandon, just north of Carberry, Manitoba, which has limited medical facilities when you're talking about something of this scale. So 30 paramedics, numerous ambulances, 4 aircraft that actually, one aircraft actually flew in from Regina to start airlifting people here to Winnipeg. Code oranges declared in 3 different hospitals, in Brandon, at the Health Sciences Center here in Winnipeg, and also in Portage la Prairie, and moving of about 28 patients just to make room for the patients coming in, patients that were sent out to other facilities in order to accommodate all this. So a massive draw on the healthcare system here in Manitoba. As for the extent of the injuries, currently we don't know, as I say, specific patient injuries, but again, 6 people in critical care, 4 people being managed in a surgical unit, and according to the RCMP from last night, another person, an 11th person, that would have been the driver of the semi, was taken to hospital but was actually released last night.
One of the things that they were talking about in this press conference, Cam, is the fact of the age range, and that could make the injuries more complicated.
Well, absolutely. So the age range of the people that are in hospital right now between the ages of 60 and 80 years. So you're getting people that are elderly, and we know, looking at the footage of the wreckage, that there were people in wheelchairs. There were people that were using walkers. This was an elderly group of people that was going for a fun trip to the casino, right? So that will be a factor in the recovery of some of these people. The sheer ability of a aging body to withstand this kind of trauma, and we heard the doctor speaking about this. But no matter what, this was a horrific crash. And when you look at the state of that bus, and when you look at what happened on the highway there, and you take a look at the wreckage, the notion that anyone survived this really is somewhat incredible. And 15 people still, we're talking about 15 people dead as a positive right now, because we were expecting that number to go higher. But the sheer loss here is just something else, and something that this province has not seen in modern times.
And just talking about how big this mass casualty was, they're getting help from people who dealt with the Humboldt, which happened a couple of years ago. That was mentioned as well.
Yeah, so the Humboldt keeps factoring into this. So the Humboldt crash happened 5 years ago, and what we're hearing from health authorities is that, or health officials here, that people that were involved in Humboldt in the initial response and in the ongoing response to what happened in Humboldt have been calling and are being accessed. So we heard the health officials today talking about setting up some meetings and looking at best practices, what was done in Humboldt. Really, it's not exactly the same accident that occurred in Humboldt, but it is so similar that there are definitely going to be parallels here, and there are going to be things that can be taken from what was learned in Humboldt and applied here. So we're hearing that from health authorities, health officials, and we're also hearing that from the RCMP, that members of the RCMP that were tasked with figuring out what happened in Humboldt are also going to be consulted and possibly brought into this investigation as well. So definitely a lot of parallels between what happened in Humboldt those 5 years ago and what has just come to pass here in Carberry, Manitoba.
Cameron McIntosh in Winnipeg, thank you for the latest. We'll see you in a bit. Now, just a reminder, if you're a family member in need of support in Dauphin, Manitoba, here's the number you can call for support. 204-647-5058. There is also a support center set up at a Lutheran church. We'll continue to bring you all the updates.